This is a case example of a football player who sustained a posterior labral injury that progressed to a 270-degree tear. This was an 18-year-old cornerback who had a solid hit on a kickoff and felt his shoulder posteriorly dislocate. It reduced spontaneously, and he continued to play for another month while braced. On imaging, he had a posterior reverse bony Bankart lesion, as you can see in the MRI, and we CT scanned it to see that the fragment was not quite as big as it appeared on the MRI. When we got into the shoulder looking anteriorly and superiorly, he had a labral tear anteriorly at the superior aspect of his anterior labrum. His inferior labrum was intact, and then he also had a slap tear, a superior labrum from anterior to posterior tear. As we viewed posteriorly, the tear extended posteriorly for a full 270-degree tear. When we repaired this, first superiorly with 2 suture anchors just underneath the biceps and posteriorly behind the biceps, and then 2 anterior suture anchors at the superior aspect of the anterior labrum. We then turned our attention posteriorly, and the tear extended posteriorly from the full 6 o'clock position to the 12 o'clock position, and it did have an osseous fragment, although that was small. We repaired posteriorly with 4 additional suture anchors. These were knotless mechanisms that allowed for a knotless repair. We expect a return to timeline with these types of injuries of 4 to 6 months. These 270-degree tears take a little bit longer to heal, and we're a little bit more careful than a standard anterior labral tear and a standard posterior labral tear. We follow our standard posterior labral repair protocol.